Frey's syndrome or gustatory sweating or auriculotemporal syndrome. Frey's syndrome are also known as gustatory sweating or auriculotemporal syndrome. So it is characterized by flushing and sweating of facial skin along the region of distribution of auriculotemporal nerve. So it present, that is flushing and sweating of the facial skin, distribution of the auriculotemporal nerve. So it is an unusual phenomenon which arises as a result of the damage to the auriculotemporal nerve. Pathogenesis auriculotemporal nerve. Its sensories are play to the preauricular and temporal region and carries parasympathetic fibers to the parotid gland. Once the nerve get damaged, the scar formation occurs around the nerve. So the fibers regenerate, become misdirected and connected with the sympathetic nerve fibers of sweat gland. So after damage, it gets regenerated and gets connected with the sympathetic nerve of fibers of sweat gland and blood vessels of the facial skin. So the parasympathetic fibers would therefore induce salivation and inadvertently stimulate the preauricular dermal sweat gland and arterioles, causing vasodilatation. So vice versa reactions. So parasympathetic fibers would therefore induce salivation and inadvertently stimulate the preauricular dermal sweat gland and arterioles and causing vasodilatation. So variations of the Frey's syndrome, chorda tympani syndrome and gustatory lacrimation syndrome. Here, what is chorda tympani syndrome? It occurs when there is injury to the submandibular gland. But in auriculotemporal syndrome, there is affect of auriculotemporal nerve. And gustatory lacrimation syndrome, this when there is injury to facial nerve proximal to geniculate ganglion. Facial nerve proximal to the geniculate ganglion injury cause the gustatory lacrimation syndrome. So chorda tympani syndrome, injury to submandibular gland, and gustatory lacrimation syndrome, injury to facial nerve proximal to geniculate ganglion. Next, moving on to etiology. First one is surgical operation. It follows surgical operations such as removal of the parotid tumor or ramus of the mandible. It also follow superficial parotidectomy, also causing auriculotemporal syndrome, and parotitis. It is an infection of the parotid gland and it also damage the auriculotemporal nerve. And congenital, it due to the birth trauma. And drainage of the abscess, it may be caused by the inadvertent incision for drainage of parotid abscess, also causing this condition. And transaxonal excitation, some cases of gustatory sweating appear due to transaxonal excitation rather than actual anatomic misdirection of fibers. So radical neck dissection, some cases may develop after radical neck dissection. So these are the etiology for auriculotemporal syndrome or Frey's syndrome. So after removal of the parotid tumor or ramus of mandible, and after parotitis and congenital. The next, moving on to clinical features. Here the age and sex predilection is not particular. And symptoms, the patient exhibit preauricular flushing and sweating of the involved side of the face. So preauricular flushing and sweating of the involved side of the face. So it's mostly unilateral, following ingestion of food or visual stimulation by food. So when we get sweating on the side of the face after ingestion of the food or visual stimulation by the food, patient may sometimes feel pain while eating. So the severity of sweating is increased by tart food, and profuse sweating may be evoked by parenteral administration of pilocarpine. So this sweating is provoked by parenteral administration of pilocarpine and it is eliminated by atropine. So local skin temperature can rise up to 20 degrees Celsius. So here the pilocarpine is provoked and eliminated administration of atropine. So this is the important symptoms of auriculotemporal syndrome. And crocodile tears. What is crocodile tears? In patient exhibits profuse lacrimation when food is eaten, particularly hot and spicy food. So crocodile tears also as a symptom of auriculotemporal syndrome. And cutaneous hyperesthesia. So presence of cutaneous hyperesthesia in front and above the ear, the area supplied by the auriculotemporal nerve. So in front and above the ear, that is supplied by auriculotemporal nerve. It produces cutaneous hyperesthesia. So these are the clinical features for auriculotemporal syndrome. So what are the symptoms? And crocodile tears and cutaneous hyperesthesia. Next, moving on to diagnosis. Minor starch iodine test. So this test is done for the diagnosis. Here, first step is coating with 1% iodine in the preauricular area. Coating with 1% iodine in the preauricular area. And next step is application of starch in that area, dried after application of the iodine. After drying, starch is applied on the skin. Sweating stimulant. Patient is giving chocolate to induce the sweating. Positive. When the test is positive, bluish black discoloration is seen in the area of sweating. It indicates auriculotemporal syndrome. So first one is coating with 1% iodine in preauricular area. The next step is we have to dry that area and starch is applied on the skin, and patient is given to some chocolate or something to induce the sweating. So if patient is positive for auriculotemporal syndrome, the bluish black discoloration is seen in the area of the sweating. The next, moving on to management. So here the first step is nerve dissection. Intracranial division of the auriculotemporal nerve has been reported to be successful, and inserting physical barrier. So here, to prevent the re-innervation of the sweat gland, many clinicians prefer to insert a physical barrier, that is porcine dermal collagen, autogenous tissue like fasciolata, and temporalis muscle. The next, moving on to pharmacological agents, we have to use atropine and scopolamine and glycopyrrolate. So 1% glycopyrrolate lotion or cream given as an injection. And botulinum toxin, so it is a recent advance in the management of the Frey's syndrome, and it is a neurotoxin, block the release of the acetylcholine.